Yeah, this was a survey of 500 patients that had either an angioplasty with a stent placement or open heart surgery, either as a planned or an unplanned procedure. And the goal of the survey was to look to see how the procedures affected patients' quality of life. And in 4 out of 5 patients that had angioplasty and stent placement, their quality of life was much better than prior to the procedure. And indeed, patients with angioplasty and stent placement got back to work 3 times faster than patients that had open heart surgery. And when they got home, they felt like they were less of a burden to their family and friends following an angioplasty. Well, the significance is that with a disease like atherosclerosis and heart disease, this is the #1 cause of death in America, and it's important to know, for patients to know, that there are lots of treatments available, and that treatments like angioplasty and stent placement will improve their quality of life, that get them back doing what they want to do, whether it's, play with grandkids or, go on a long walk, those kinds of things. And an interesting finding of the study was that there was about a 12-point percentage increase in improvement in their sex lives.
Well, about 4 years ago, I was experiencing an increased level of fatigue, shortness of breath, and was having trouble recovering quickly from exercise or doing tasks like yard work and moving boxes around the house, preparing for a move. And when I discussed these symptoms with my cardiologist, we talked about the various treatments that were available, and we decided that, given my age and my family history, that the angioplasty was the procedure to pursue. And during that, we discovered 2 blockages, and 2 stents were put in place. Well, I tell you, almost immediately I experienced a return of energy. I did not have the shortness of breath. I was able to pick up a more vigorous exercise program and begun traveling and getting involved with community work in my retirement. So having the energy and not having the fatigue, I think, were key to me being much more involved than I was in the past.
A great site for information regarding this study, but also other cardiovascular disease issues, is secondscount.org. So angioplasty and stenting are procedures that we do through the skin to open blocked heart arteries. Your cardiologist would thread a small tube through the groin or through the wrist and pass it to the heart. And using X-ray dye and X-ray would be able to see the blockages. You pass a tiny little wire, about 14 thousandths of an inch, past the blockage. And that kind of becomes, if you will, kind of a railroad line that you can move equipment up and down to treat the blockage. So you can slide a balloon over the wire, open the artery up, and then deploy a stent, a small metal tube that you blow up with a balloon to keep the artery open. So angioplasty and stenting is one of the proven ways of reducing symptoms from heart disease.
Well, the key advice is to share your symptoms with your doctor and decide jointly what would be a good next step for you. Post-procedure, my advice would be to continue an active exercise program, watch your diet, and watch your weight. I think those 3 things, if you're a non-smoker, if you're a smoker, start with not smoking anymore, but those 3 would be critical post-procedure.